I want to make a quick video because there has been a recall on artificial tears. I personally have Sjogren's, and that causes severe dry eyes and dry mouth. So I am constantly using artificial tears. So this really was very scary to me. There have been 55 cases of severe eye infections, 1 death in Washington, and 5 cases of permanent vision loss related to the use of artificial tears that were contaminated with Pseudomonas. The CDC warned of a multi-state outbreak of an extensively drug-resistant strain of the Pseudomonas that is linked to brands of artificial teardrop. Primarily the teardrops that were associated with this was EzriCare artificial tears and Delsam. So if you know anyone with EzriCare or the Delsam brand of eye drops or that were manufactured in those laboratories, tell them to immediately dispose of them. Infections were identified in 55 patients in 12 states: California, Colorado, Connecticut, Florida, New Jersey, New Mexico, New York, Nevada, Texas, Utah, Washington, and Wisconsin. Outcomes included hospitalization, permanent vision loss from cornea infection, and 1 death due to systemic infection. So many of these patients said that they had used this product, which is a lubricant used to treat irritation and dryness. Again, could have been me because I use literally eye drops every single day for my Sjogren's. And the eye drops are sold under the name EzriCare, I hope I'm pronouncing that right, and is made in India by Global Pharma Healthcare. The FDA said the company recalled unexpired lots of EzriCare artificial tears and another product, Delsam's Pharma artificial tears. The FDA recommended the recall based on manufacturing problems, including lack of testing and proper controls on packaging. The agency also blocked import into the United States. The outbreak is considered particularly worrisome because the bacteria driving it are resistant to standard antibiotics. Investigators found that the bacteria were not susceptible to any antibiotics routinely tested at public health laboratories. And this is very, very scary because more and more bacterial strains, fungal strains are becoming resistant to our antibiotics, are becoming resistant to our antifungals. And you know, that new show that we're a breath away from this happening. Not to be all doom and gloom, but we have to be good stewards of antibiotics if we're a prescriber. And if you're a patient, I encourage you, if your provider does not think you need antibiotics, please trust them. Give it a few days. If you have a sore throat on day 1, you don't need an antibiotic. Give things a few days. It's probably a viral infection. This specific bacteria had never been reported in the US before, according to the CDC. The FDA has issued a safety warning. If you have these eye drops, you should immediately stop using them, either the EzriCare or the Delsam Pharma's artificial tears. And the agency said that it had recommended the recall of the products due to multiple manufacturing violations by Global Pharma Healthcare, including lack of appropriate microbial testing formulation issues. The company manufactures and distributes the ophthalmic, the eye drop, in multi-use bottles without an adequate preservative, and a lack of proper controls concerning tamper-evident packaging. And the good thing is that the FDA is no longer going to allow them from bringing in their products. Please, individuals should seek medical care if they have signs or symptoms of infection, including eye discharge, eye pain or discomfort, redness of the eye or eyelid, feeling of something in the eye, increased sensitivity to light or blurry vision. And if you have been using those eye drops, please let your healthcare provider know if you develop symptoms. Healthcare providers should advise patients who used EzriCare artificial tears to monitor for infection and should perform culture and antimicrobial susceptibility testing when clinically indicated. They should also ask patients they are treating for keratitis whether they have used the product. Providers should consult a specialist with knowledge of antibiotic resistance when treating this infection. Patients who are infected should be placed in isolation and contact precautions should be used. For now, the CDC does not recommend testing patients who have used the product who don't have signs of infection. Thank you so much for watching.